Welcome to the UN Brief. Today we interview Ambassador Amandeep Gill and Dr. Mehdi Snène. They are leading the International Digital Health and AI Research Collaborative, a Geneva-based global platform that enables and improves access to inclusive, impactful, and responsible research into digital health and artificial intelligence. I-DAIR's mission is the transformation of personal and public health through collaborative research and development of digital technologies. Thank you for watching and listening to the UN Brief, and don't forget to subscribe.
So you mentioned that telehealth is a very powerful instrument to reach those who cannot access medical care in their current surroundings. So that's just one example of what digital health can do. We are focused at I-DAIR on the long-term opportunity in digital health and artificial intelligence for health. When I say long-term, this means both personal health, so precision personal health, where a particular person's difficulties are addressed in a way that respects their current context, that respects their choices, and their unique body and their unique experience. So there is a potential, long-term potential for that. And also public health. So let's call it precision, effective, low-cost public health. With the pandemic, we've seen how health systems, both in rich countries and poor countries, have struggled. So how do you make sure that in the future, your health systems are cost-effective, they are resilient, and there's no way to ensure that without deploying digital technologies? What we've achieved so far, we have brought focus on the opportunities in low and middle income countries, the global south, the talent there, the innovation that's happening there, the need that is there. We've also put a focus on research and development as a key driver of digital health in the future. Because you can have all kinds of solutions, but if you don't have the deeper knowledge-making ability, then you get left behind. And also, you don't do science-based, properly benchmarked solutions. So we want to bring some kind of a deeper enabling of the R&D ecosystem. And maybe that's the point where I can, request my colleague and successor at I-DAIR, Dr. Mehdi Snène, to come in. He can tell you about a couple of the specific achievements.
Yes, thank you so much. Yes, Dr. Mehdi, I would like to hear from you about also the, you have just made a partnership with a publication, a scientific publisher, Frontiers. Can you talk to us a little bit about that?
Would you like to talk about the this specific publications partnership?
Yes. So this specific publication is in the domain of digitally enabled pandemic surveillance, preparedness, and response. So we worked over the last 1 year plus with partners from nearly 20 countries, many of them LMICs like Brazil and Vietnam, to put together a global pandemic scheme. So the architecture of a global pandemic scheme, the R&D agenda for that, what needs to be developed and how, that's been put together by I-DAIR through this collaborative effort. So this series of publications would detail that R&D agenda, would detail not just the data requirements, but also the kind of AI models that would be required, and what kind of dashboards for presenting conclusions, assessments to policymakers would be required. And in parallel, what kind of governance requirements, because you need to incentivize countries to participate in such a scheme, to contribute data and expertise and insight. So these publications will detail that. We had our first harvest from it recently when the BMJ, which is a reputed medical journal, published a piece by this group led by I-DAIR on citizen science. We have often looked at people.
Right. I saw that. Yeah, I saw that. Yes, there is a great push now for actually, and we have the gathering systems in place for the data, right? For and understanding what that means in terms of gathering the data from citizen science. The premise is that everybody contributes, right?
Yes, but in a kind of more meaningful way, because if we look at citizens only as sources of data, but we don't look at them as participants in policy making.
As designers of policies.
The lens is different. So it's citizens' participation in science, and not so much, they are like passive sources of data through contact tracing apps and so on. We also want to push this into the modeling area, where we are working on participatory modeling. So it's not just you gather the data, put together sophisticated AI models, but you also involve people, particularly health workers, frontline health workers, public officials, in the design and in the operation of those models.
Dr. Mehdi, how would you describe which were some of the accomplishments in the last year, and what are you looking forward to? You are going to take the baton, as we say, no? You're going to now continue carrying forward the mission of I-DAIR.
Yeah, it would be a tough mission to succeed to Amandeep. But one of the early harvests is our initial thinking regarding what is digital health and what is not digital health. It was so confusing at the beginning to see all the existing works being plaqued to digital health, although many of these pieces are not directly linked or even linked to that space. So we've started by a very essential element in this two last years about establishing the domain and understanding what is our area of actions, what is digital health and what is AI in digital health. Then a second part was about understanding the utility, effectiveness, and efficiency of what is being done. You may know that there is a lot of junk AI. There is a lot of harmful AI, and then there is always missing parts when it comes to the ethical and the governance of the AI. So that's the second layer. After understanding the domain, was about understanding what can benefit to end users, and how to distinguish between and benchmark between the usefulness and the harmful AI or digital approaches. So this is currently one of our pilot projects in terms of benchmarking, but also in terms of governance and ethical perspective and ethical and gender consideration inside of these domains. Third phase was about implementing some of these digital public goods. So we start rethinking with our own eyes the entire space of digital health. And specifically, the GRM was the first piece. It could help us, and the initial intention is to help us understanding gaps, bottlenecks between different countries, how to reduce these disparities between different countries in both research, but also on the ground in development. Many countries struggled to implement an effective telehealth strategy during the COVID-19, but also many countries struggled to implement AI research oriented in clinical science, either during the COVID or post-COVID. And we are seeing that many of these countries are lacking of the essential elements and early elements to seed and to implement these kind of clinical research. So one of our first piece of work was the GRM, the Global Research Map, where we have done a landscaping of the 9 regions as classified by the UN of the research and development activities in terms of digital health and AI. So we got this understanding where we are moving to, who is being left behind and where our action should be dedicated. And this tool is not only for IDAIR at this stage, but also it's somehow dedicated for these countries, funders, philanthropic activity, and also for research program buildings. Within the tool, we got the early understanding of the global trends and next moves that may happen in digital health and AI. And quickly, when doing the landscaping of R&D, we discovered that this is very tightly linked to national digital health strategies. So if you have some specific research funding in your country, then you have better activity in research, which is very logic in some sense. So we coupled our benchmarking methodology and landscaping methodology with a benchmarking and maturity assessment of national digital health strategy. Both of these approaches that we have done are not classic approaches based on desktop research or based on questionnaires. It's much more done by the usage of natural language processing, which is a technical coming from the AI, and AI methodology. So what we do is that we review and we capture data sets, and then we do some automatic analysis, base it and use it with the AI to reduce time to results, but also to be able to produce some near real-time results. And we got some nice finding that recently got confirmed by a new publication by Nature, confirming the trends that we have detected in the R&D landscape.
Yeah, it seems like in the area of telehealth, in particular, as you were just mentioning, the challenges that were present during the pandemic and post-pandemic, is that the countries, low and developing, low-income countries, middle and low-income countries, do not have the infrastructure necessary to deliver these services. We have here, maybe in the West, we have a lot of the developed countries have the infrastructure, 5G already, or we are looking at 6G, or what's next, right? Quantum computing and all that will make all these technologies, all these applications of these wonderful technologies possible. But the other countries are sort of playing catch up, whereas they don't have legacy systems that maybe do not support this fast entry into this next level of healthcare for public health. There is the challenge of making sure that this infrastructure is in place, no? So I know ITU is working, for instance, with UNICEF in a project called GIGA, where they're trying to connect all schools, right? And that mapping of schools and so on certainly would help, to bring people up to, and the importance of infrastructure, right? So, yeah. Ambassador, could you comment on that, on the importance of infrastructure in terms of bringing all countries up to speed in terms of digital health?
Right. So that's a very, very important component, and you referred to the excellent initiative by ITU and UNICEF, GIGA. And the roots of this initiative are in the UN Secretary General's high-level panel from 2018-2019. So imagine in parallel the missing piece when it comes to R&D of digital health. So clinical researchers, public health specialists in LMICs lack access to low-cost, high-quality AI infrastructure to be able to use their own data sets for researching and developing solutions that are specific to their context. And they can always upload their data to countries in Western Europe or in North America, but that way they are not able to kind of develop their own ecosystems. So our focus in I-DAIR is to put together a distributed infrastructure. We call it TRI, Trusted Research Infrastructure, which has something like an AI in a box. So it's the right hardware capacity combined with an intuitive set of software tools, which kind of flattens the learning curve for those who are not coming from a computer science background. So these could be doctors, biologists, public health specialists. So using this infrastructure, they can start to work with their own data. At the back end, this infrastructure is linked to a neutral data storage at the UN International Computing Center. So UNICC is one of our partners. So they are helping us to build that backend. And IDAIR's role would be a neutral kind of escrow, a manager, neutral independent manager of this infrastructure, and also to put in, as Mehdi was saying, the importance of benchmarks and governance and ethical consideration. So how can we integrate some of these considerations into the infrastructure so that the solutions that are developed they meet the international criteria, the WHO guidance, and other international principles and norms? Mehdi, if you want to.
Yes, Dr. Mehdi, tell us a bit more also about these opportunities in terms of precision medicine and what else we are looking at. And also, I'd like to wrap it up. I would like to know a little bit more about the funding mechanisms that you are hoping that you are already using, because you are private and public partnership basis in a way for the funding, for the continuity, for the longevity of I-DAIR?
So we are a non-profit foundation. We are currently based at the Graduate Institute, one of Europe's oldest academic centers in development studies and international relations. We are also taking the first steps to registering I-DAIR as an independent foundation, non-profit foundation under Swiss law. And that'll be a step to independent host country agreement with Switzerland as an international initiative. So we have current funding is from foundations. So we are working with several global foundations. We have recently finalized with a development cooperation agency as well. So it's this kind of funding, and we have plans next year for a substantial I-DAIR fund, which brings together public, private foundations and other investors for this kind of enabling investments into infrastructure, human capacity, benchmarks, governance, and some of the global public goods that Mehdi was mentioning. So on precision medicine, I'll defer to Mehdi. He is the expert.
Yeah, when it comes to the precision medicine, there is a big disparities, even in Europe and high-income countries, and even in the same country, depending on your own location and where you are being treated. So most of the precision medicine is dedicated to the cancer treatments at this stage, and that require firstly to establish a genomic database, which are somehow a population databases, a big population databases about their genetic, genomic, phenotype data, a lot of data and data sources to be stored and to be secured somewhere. This should be within a global national perspective, which is not the case today. Most of the players and actors are private companies in that space, and this is a very good initiative, but it should be under some restrictions when it comes to low and middle income countries, and it should be, I think, hopefully within national strategies rather than with private companies. Because at some point, this is the humanitarian interventions, and you cannot simply keep it within hands of private companies and dedicated to reach people who can afford these kind of interventions. So it's our vision of the precision and personalized medicine. We need to, within our work, to make the awareness, to raise the awareness and sensitivity towards these kind of data strategy. What kind of data are essential to be able to implement these high potential approaches in medicine, especially with the highest increase in prevalence of cancer across all the countries that are observed for the moment, and how to maybe form some alliance, a regional alliance between small countries to help them coming over these kind of technical difficulties, ethical difficulties, but also knowledge difficulties. You need to get access to some kind of capacity building that is very restricted right now, and is not accessible to all practitioners and researchers in low and middle income countries. So there is an urgent action to be taken there. Is firstly raise the awareness regarding the data importance, saving lives when it comes to precision and personalized medicine, but are also about how to make these alliances in order to form somehow clusters of knowledge, regional clusters of knowledge that will be able to manage this kind of data and use it as the best of it, extract the best of it for the patients. If we keep these siloed approach within these small countries and low-income countries, I think that it will take much longer time. And once they will establish these personalized and precision medicine approaches, we may be at the next level of digital innovation within that space. So hopefully we will able to shorten the time to get access to this kind of infrastructure and knowledge within some clusters. And this is why we work within our hubs with our partners and hubs that are distributed across the globe to detect these needs, but also to raise the awareness and to form these new set of collaboration. Often there is very few collaboration in South to South, especially when it comes to this space. And we would like to make it happening again in South to South, collaborating together and bringing the necessary and required knowledge and infrastructure to them in order to accelerate the access to this kind of medicine.
Yes, you mentioned a very good point also, of course. I made a comment earlier that, we think of middle and low income countries having challenges with infrastructure for using, all this potential data and all this potential we have for public health outcomes, digital public health outcomes. But it is true that in the West, in developed countries, we are seeing very clearly that there is a huge divide in terms of access to health, right? I mean, there is health, but you don't have access if you are not rich, right?
Yeah.
There's no universal health care. It's a promise has never been fulfilled. And Dr. Tedros from the WHO is actually working quite steadily on that aspect, right? Because it is not enough to have all this great medicine, but if the great majority of the population cannot access or make use of this, right? Yeah. So to finish it up, Ambassador, I know you have been appointed Tech Envoy for the United Nations. Congratulations. I don't know, would you like to comment a bit on that now, or you'll save for later?
No, I would like to save it for later. I have not yet assumed my functions. That will happen on 15th July, but it's a great honor. It's also a great honor for the work that we've been doing at I-DAIR. The digital enabling of the SDGs in an inclusive, responsible, and impactful manner. And I couldn't add anything to what Mehdi just said. In terms of the need, the necessity, the urgency of this action that we are engaged in, if we are not to deepen the digital divide further, and if we are not to repeat the mistakes of this pandemic, the COVID-19 pandemic. And completely agree with you, Dr. Tedros, his focus on universal health coverage. In fact, we will be deepening our partnership with the WHO and supporting them in their mission on the UHC, as well as deploying digital health responsibly and inclusively.
Yes, you have an amazing path ahead, and we are at the UN Brief very, very pleased to hear that you are the person who will be in charge of this very important appointment. Dr. Mehdi, thank you so much, and I look forward to continuing the conversation and finding out more about what the International Digital Health and AI Research Collaborative will be doing in the future. Thank you so much.
Thank you so much. Thank you.
Have a very nice day. Thank you.
Bye.
Thank you for watching the UN Brief, and don't forget to subscribe